This is our case study, COVID-19.
I'm Danielle Taylor.
I'm Kiana Sullivan, and I'm Haven Taylor. Brief history of the virus. Though the corona family has been around for years, COVID-19 was first discovered December of 2019 in China. Corona derives from a strain called SARS, and COVID-19 is an airborne disease.
Brief history continued. Different cases, deaths, hospitalization, and vaccinations throughout America.
And this is the worldwide global statistics.
Case reference as profiles. The age is like 73, gender, woman, and social status, upper middle class.
Relevant social practices and environment. Social interaction, everyone was to stay at least 6 feet away from each other with a mask on in public, and there was an 8 o'clock curfew. Work environment. During the pandemic, majority of everything was shut down or people's jobs were moved online using Zoom. Movement or travel. They did not allow travel for some time because that was a main issue with the virus spreading.
Medical history, health conditions, past. The patient has a history of seasonal allergies. The patient has not been vaccinated for COVID-19. The patient is not taking any prescription medications. And then the patient has recently contracted COVID-19 and reports having some difficulty breathing. The patient plans to get immunizations.
Description of the case, clinic visits. She came to the fever clinic of First Hospital in Changsha. The chief complaint of the patient was a fever. Her body temperature peaked at 39 degrees Celsius with cough, expectoration, shortness of breath, and general weakness that started prior 5 days. She developed mild diarrhea 2 days prior to coming to the hospital.
Diagnostic procedure, lab test performed. A CDC 2019 novel coronavirus real-time RT-PCR diagnosed panel is a test used that will accurately detect SARS-CoV-2 in respiratory specimens. Now they have at-home tests and testing sites. Lab test results, you can either have positive results, which indicate you have COVID, or negative results that indicate no COVID was detected. Confirmation sex inclusion. Testing specimens from your nose and mouth. There are two main tests, which are a antigen test or a nucleic acid amplification test.
Treatment, case handling, and management. When diagnosed with COVID-19, they will tell you to quarantine for 2 weeks as well as wear a mask. Treatment administered. The FDA authorized some antiviral medications and monoclonal antibodies for treating mild to moderate symptoms. Case prognosis. People under the age of 65 have a small risk of death, and people over the age of 65 with an underlying condition have more deaths. Case outcome. The outcome of COVID-19 case has led to people becoming really ill. Some people have recovered with some minor changes within their bodies, and a lot of cases have resulted in death.
Preventive measures, wear a mask. COVID-19 can be spread by droplets, such as when you speak or cough. A mask helps slow the spread of the virus. Get vaccinated. COVID-19 vaccinates helps with immunity and lower your chances of contracting the virus. And social distancing. Being in a crowded area in any easy way to catch any disease or virus. Social distancing keeps you away from people who might have the virus.